most common seizure we will see is a grand mal seizure. This is kind of our classic appearance of a seizure. It's also known as a tonic-clonic seizure. And the tonic-clonic seizure aspect of it refers to the two main components of the seizure. First, the tonic phase. And these patients are typically unconscious. They will be lateral. Most of them will salivate. They typically will urinate or defecate, and their breathing is irregular or absent. You may end up seeing an absent breathing in these patients simply because of the intense muscle contraction of the body. This can cause cyanosis, and in some patients can cause a mimicking aspect of a syncopal episode. So it's important to try to differentiate between the two. After we have our tonic phase in these patients, they tend to go into the clonic phase. This is where we see that paddling, that chewing movement. Some of these patients will vocalize, but this rhythmic jerking is usually very apparent here. And so we all typically like to think we know what a seizure truly looks like. And so I've got a quick video here that I'm going to pull up for you guys. And so you can see the patient salivating on their side. They start to go into the tonic aspect of the seizure here in just a second. See how the patient is continuing to salivate. And here's the tonic aspect of it, where they become very rigid, intense. And you'll see there's not a lot of rhythmic paddling. It's more the tenseness and the contracture of the musculature. After that, you will see the clonic phase here shortly, where the patient will begin the rhythmic movements. You can see in the pelvic limbs now. You'll start to see it in the jaw here in a second. You can see the chattering and the teeth movement. So whenever we see these seizure events, we always say, okay, these are typically grand mal seizures. But there are a number of other different types of seizures as well.